For WYSU, I'm Gina Marinelli. Joining us today is Heidi Larew, who is Art Therapy and Program Director and Clinical Supervisor at Alta Care Group. Thank you for being here, Heidi.
Thank you for having me.
So, how does art therapy work? And this is geared specifically to children?
In this case it is, but it is used for all ages.
Okay, well, how does it work?
A master's level art therapist helps an individual use the creative process to explore their thoughts and feelings, develop coping skills.
Is it easier for kids to talk about their feelings through art than to actually speak the words?
In my experience, it seems that it is, for most children, easier to have some artwork in front of them that they are working on while they're talking.
Now, what medium do they work in?
They often use paint and canvas, sometimes sculpture, collage, markers, crayon. It really depends on the person's interest and their abilities.
What is the end goal? What is it that you hope for with each patient? How will art help them get to the source of their troubles?
What we're aiming for is improved wellness overall. And like I said, it's very individualized, so it depends a lot on the individual. If the child has anxiety or depression, we want to decrease those symptoms. It's very individualized to the person, so we come up with a plan for how long we're going to work with them and what their needs are, and we work toward that plan based on what that person needs right then.
So they're one-on-one then, it's not a group of children?
Well, that's another, it depends.
Okay.
So there are times when there are individuals who work with one therapist, and there are times when there are groups.
Mm-hmm. So how long are the sessions?
Each session can range. It could be a 30-minute session or a 45-minute session, and then over the long term, we might work with a child for 6 weeks, 8 weeks, could be a fefew months, could be off and on throughout their childhood. It depends on the person.
Wow. Now, you've been doing this for over 20 years. What are the changes to this approach that you've seen since you got into this?
When I graduated from Ursuline College with my master's in art therapy, I started with some placements with senior citizens, so that would give me a wide range of perspective because those people would be older now. And many of my clients at the time would say things like, oh, I can't do that, I can't draw a straight line. Mm-hmm. And now, doesn't matter on the age, I really don't hear that as often. People seem to understand that it isn't an art class where they need to be able to do a perspective drawing. They understand that it's about looking at their own internal experience and developing insights into their lives. That's a huge change I've seen in the field.
Any special considerations when you're dealing with children?
Well, I guess there's a lot of considerations. They're not at the same place with abstract thought, so that's different. They're minors, so how we're going to communicate with their parents. Sometimes containment, not wanting to get art supplies on the walls or things like that. Making sure that we're not using any toxic materials.
Sure. If somebody wants to get their child involved, how do they go about that?
They could call Alta Care Group and set up an appointment with our intake people.
And how long are the sessions? Is this like a 1 hour session, 2 hours?
They're typically about 50 minutes. There is some variety. Some children benefit more from like a 30-minute session, and some will attend something like a group that might go for an hour and a half.
What are the challenges that you see in getting to help children through artwork? What are some of the challenges that you face and the child faces?
Well, some kids have the idea that I'm not an artist, that sort of thing. And
trust, I would imagine.
Yeah,
you've got to get them to trust you.
Yes, to understand that they're not going to be graded on it. Transportation, that's different than getting an adult client. A child, you have to work around their parents' schedule, their whole family's schedule, those sorts of things.
You must get a lot of joy out of working with a child, though, and seeing them come to grips with whatever is bothering them.
Yes, yeah, I'm really grateful. I'm grateful for the outcome of helping them get better, feel better, but also the moment of just being with the person as well.
Oh, that's great. Yeah. Well, I wish you continued luck in that. Heidi Larew, who is Art Therapy Program Director and Clinical Supervisor at Alta Care. Thanks for being here.
Thank you.
For WYSU, I'm Gina Marinelli.